cases that we saw were local cases. So the virus was brought from abroad, started spreading among the Lebanese community, and then by August it became that this is the major way of transmission. It's local in Lebanese patients. By August 27, we had 15 hospital admissions and 2 deaths. As we know, the Ministry of Health has been quite aggressive. They've done surveillance system, they've done awareness campaign. Initially, it was obligatory to report every single case because they wanted to keep track of the volume of the pandemic. How many cases are we seeing? But now we're no longer reporting every case. As I said, many of the cases we're seeing, we're tackling over the phone and they're not being reported. The other thing that the Ministry of Health made available is the availability of the PCR polymerase chain reaction test at the Rafiq Hariri Hospital, where they offered this test for free. Anybody could go initially and have this test done. Now there's more restriction because we have a very limited supply of the test, and because we have realized that the virus is quite mild and it's not causing a lot of complication and death, we're limiting who should be tested, and I'll go over this in a minute. So the July 30, the Ministry of Health of Lebanon declared the virus as not a lethal pandemic. I think this was very important to alleviate the fear and the panic that was spreading in Lebanon. Per WHO, we are now testing only the high-risk groups, meaning patients who are sick enough to come to the hospital to be hospitalized. If the patient has comorbidities, if you have a grandma who has cancer and is on chemotherapy, we need to test that. If you have an AIDS patient coming with suspected symptoms, we need to test that. Diabetic, out of control. Pregnancy, again, because pregnant women are supposed to be high-risk patients, and patients who have close contact with patients with severe disease. For example, if there is one that developed swine flu and died in a certain house, and other people develop symptoms, now you might want to give special attention to this family because the virus was more virulent in this particular home. But other than those, we are really not testing people who present and say, I'd like to know if I have H1N1 or not. And I'll go over why we're not offering the test to everyone. My estimation of how many cases we have in Lebanon, I think we have several thousands, maybe 6,000, 7,000, or even more. I spent half of my day answering phone calls about patients who have typical symptoms. And again, we're not telling them to come and seek medical attention because we are reassured by the fact that the virus in most cases is very benign. So most of them that we have seen in Lebanon have been very mild, and the majority we manage as outpatient. We tell the patient, take Panadol, take Trampena if you're vomiting, drink lots of fluid, so just manage outpatient. A few patients have required hospitalization, obviously. Elderly patients are more likely to require hospitalization, and a very young infant, between the 0 to 4 years of age. We have only had 3 deaths in Lebanon, and I'd like to stress here that these occurred in people who have underlying medical problems. The pregnant woman, in my opinion, was not handled properly. She was misdiagnosed. They did not know that she had the virus until several days after the illness. And so therefore, I don't think we should put a lot of emphasis on this case because it was not handled properly from the beginning. But the 2 other patients who died, one had cancer, and the other patient was a premature kid with multiple cardiopulmonary problems. So again, they're not the healthy people. Now we come back to some practical questions that I'm sure many of you have. Is for how long is H1N1 flu contagious? The virus is shed one day before until up to 7 days after the symptoms. But you should keep in mind that as the days go by, the virus is shed less. So on day 1, it's going to be shed a lot. On day 2, less, 3, less, 4, less. In immunosuppressed patients, if you have a cancer patient on chemotherapy, etc., these people might shed the virus for longer than in a normal patient. How is the virus shed? If you see in the picture, it's a bit exaggerated, but it is the respiratory droplets. So basically, if someone sneezes in your face or coughs in your face, the droplets are propelled within 6 feet. I'd like for you to keep in mind the 6 feet issue. So 6 feet is 1.8 meters. So to be able to catch the virus, you have to be within less than 2 meters of someone who is sneezing or coughing in your face. It's not like tuberculosis, where the virus is spread and then circulates in the room for several hours. And that was one thing I discussed with Ms. Chai about holding the conference in an open air because of the risk of transmission to parents. And I think it's important to know the pathophysiology of this virus. So you catch it if you have respiratory droplet in your face that stick to your mucous membrane for a distance of 6 feet. The other way to catch the virus is by touching contaminated secretions. So let's say I have a cold now, and I'm sneezing, I'm wiping my nose, and then I leave my napkin here, and then someone else comes and touches either the napkin or the surface, and then he rubs his nose or eats. That is another way to catch the virus. So touching contaminated surfaces, and that's why I cannot stress enough the importance of cleaning the surfaces, and we'll come back to this. It is also believed that other bodily fluids should be considered contagious. So if someone vomits, the vomitus can have virus particles. Diarrhea can have virus particles. So obviously, if you have vomitus on your hands, a stool, obviously you're going to wash your hands very well. That goes without saying, but that's another way that the virus can be transmitted. Now, what are the clinical manifestations? How does H1N1 influenza present? The incubation period is 1 to 4 days. Incubation period in medicine, it means you have already caught the virus, but you still have not begun the manifestation. And that can go on for 4 days, sometimes up to 7 days. So you have been exposed, the virus is working in your system, but you have not started to manifest the symptoms yet. The majority of the patients are going to have respiratory symptoms. As you see here, this is very similar to the seasonal influenza, grippe that we usually see in our children and our patients from previous years. They will have rhinorrhea, sore throat, a dry cough is a very classical finding. Tiredness. Most patients complain of being so tired they cannot have the energy to move. And obviously fever is very common. The majority of patients with influenza H1N1 or any other influenza will have fever. Unlike what you see with common cold, where common cold you have a lot of patients sneezing, coughing, but they don't have high-grade fever. Other typical symptoms are the headaches, the chills, but also I'd like to point your attention to the diarrhea and vomiting. And actually, a recent study from this pandemic in New York, high school samples from students, looking at what are the symptoms of the patients who presented, and they're listed here with the percentages. Majority will have cough, fever, fatigue, headache, but look at the diarrhea. Almost half of them are going to have diarrhea and joint pain. And there is a range of severity. I said at the beginning that the majority of the patients we are seeing have mild disease, but obviously there are the two extremes. There are those who have barely some symptoms. We've tested some people who came back H1N1 positive who really felt fine. They just did it because they had little sniffles. So that's the one extreme. And we have the other extreme. Some people